Good morning, good morning. This is Dr. Mitra. I hope you can hear me. Um, let's make sure. Okay, this is Dr. Mitra, your ophthalmologist in Grass Valley and Roseville. And I'm here on this beautiful Monday morning again in clinic in my Grass Valley office. And essentially, I'm today I'm going to talk about the most common questions that patients ask me as they come into my office, if they come in for a cataract consult or wondering about their vision. These are some of the things that I will go over with them. So one of the most common questions is, what is a cataract? And hi, Christy. And essentially, a cataract is a change in the natural lens in our eyes that happens over time. So all of us are born with this, most of us, I would say, are born with this clear lens that looks almost like a clean window. And as time goes by, we develop some changes in the protein structure of that lens. And so it changes its ability to focus light in the back of our eyes and for us to be able to see. So this usually happens starting at the age of 50 on, although at that stage it's microscopic, and of course there are different causes for that. For patients that have diabetes or high blood pressure, or they have under certain treatments that include steroids, and even certain genetic conditions can cause this to happen earlier, of course, but it does happen in most of us. So the question is, sometimes when patients come in and I'm examining them and they have perfectly good vision with glasses, and I tell them, well, you have cataracts and this is like at a moderate stage. It may take years for it to develop, not anything that we need to worry about right now. They wonder, well, how come my previous doctor didn't tell me that I have cataracts? It comes as a shock. And I definitely give them some reassurance that all of us go through this, and perhaps the reason it wasn't, brought out as a specific diagnosis that needs to be worried about is because it's not affecting your vision at this time. And of course, cataracts grow slow, slow, slow for years until they rapidly progress and ramp up. And the only way that we're going to know whether you're at that stage of things changing more rapidly is by doing your yearly exams with your ophthalmologist or eye care provider, and they can give you an idea of whether or not you're getting close to the stage where treatment is necessary. So how can I prevent it? That's another question that patients ask. So definitely, if you have medical conditions that affect the formation of cataracts, like diabetes or any cardiovascular issues, you want to make sure that your diabetes and blood sugar is monitored and controlled. So that is very important, to make sure that you're going to your primary care and following up with your medications and things like that. Hi, Kelly. So we have and I'll answer questions as we get through, and I appreciate you saying hi. If you're on live or if you're watching the replay, I will go ahead and save this to the Facebook page. Hi, Shima. And essentially, how can you prevent it? So controlling those things that are under your control, right? Controlling the risk factors. So going to your primary care, controlling the hypertension, diabetes. One of the more important things, especially for people that are active outdoors, is controlling your exposure to UV rays. So I always, especially up here in higher elevation too, or in sunny situations, I definitely wear good quality sunglasses, and I have no share in Maui gyms, but for active people outdoors, if you're going paddleboarding, or kayaking or running outdoors, just have a good pair of sunglasses that helps protect you against UV rays. And of course, your regular glasses, you can have some filters built in that will help protect you against UV rays. So those are very important. I always advocate for including antioxidants in your diet. So lots of vitamin C. If you can, and are able to tolerate kale definitely, spinach, um, and of course, blueberries when they're in season and pomegranates when they're fresh. And if you can't, just adding vitamin C to your diet on a regular basis. Of course, it helps with your immune system, and it helps kind of mitigate or decrease some of the things that may be going on in your body that may affect development of different diseases and even cataracts too. Let's see. When is it mature? So some patients are like, oh my God, I have cataracts. Do I have to do something about it right now? And my answer to that would be no. Um, it depends. So that's why it's important for you to have regular follow-ups with your eye care provider. So essentially, what you want to do is you and your doctor will have a discussion about this, but you want to know whether you're having regular changes to your prescription as you're going to see your eye doctor. And the second question is, are these regular changes as they give you a new prescription, are these prescriptions helping you be able to do your activities, see better, and still function the way that you want? Once it gets to a point where you're having trouble driving at night even with your glasses, if you're having trouble doing the things that you love to do during the day, reading, um, watching TV, or doing activities outside even with your updated prescription, then it may be time to try and figure out exactly what's going on. So you might want to have a conversation with your eye care provider and ask them whether or not you have cataracts, and are the cataracts bad enough for you to have surgery. There's also a questionnaire that I go through when patients come to me for cataract evaluation. And this questionnaire involves how this may be affecting your vision while you're reading, driving, very specific situations. If you're cooking, trying to look at the recipe, if you spend a lot of time on the computer, if you're an accountant, and even the glasses, for you to be able to watch the computer and be able to see the numbers are not helping anymore. All of these, anything that affects your lifestyle, and it's not due to something else going on with the back of the eye, then I would say that more than likely it's the cataracts. So at that point, you may want to be referred to an eye surgeon or an ophthalmologist, and of course, have a long conversation about what your options are and how the process goes as far as once you make the decision to have surgery. So what's the treatment? So, what I discuss with my patients, it has a lot to do with the fact that one size does not fit all. And it's very much dependent on your activities, on your hobbies, on your lifestyle, on what you want to do um, with good vision and what you haven't been able to do due to that. So normally what I'll do is do a full exam, make sure that there's nothing going on with the cornea, there's no corneal scars, and that's the part that's in front of the colored part of the eye. The colored part of the eye being iris. The iris, for me, I was going to say blue, but it is brown. The colored part of the eye is in front of the lens itself. And the lens is the part that becomes cloudy. So you want to make sure that that's examined, the type of cataract that you have. I take a look and see what kind of cataract is it in the meat of the lens, as I call it, or is it more in the front or back of the lens? Sometimes, it doesn't necessarily affect you, but it affects how I approach the surgery. And of course, I take a look at the retina to make sure that the macula, which is the center part of your line of vision and is responsible for your fine detailed color vision, I want to make sure that there's no irregularity or abnormality in the retina itself. And what that helps me do is then say, yes, we can go ahead with the cataract surgery. The step after that is for you to come to my office and take special measurements of the eyeball, as I call it. So we take special pictures of the cornea, and that determines the landscaping. We can find out whether the landscaping is even or irregular. I take special measurements with a machine called the lens star. It takes intraocular lens measurements essentially. So it takes special measurements for me to decide what power artificial lens am I going to replace your cataract with, and what kind of artificial lens would work for your eyes. And I'll explain in a little bit. I also take a special picture or an OCT of the retina. And I do that because I want to make sure. So the OCT essentially, let's say this is your retina, the back of the eye, where everything focuses on that. If there's any irregularity or swelling or edema or fluid there, what happens is the light doesn't necessarily focus well if you have macular degeneration or anything like that. I'd like to know. And so I do this OCT, which takes a cross section of the macula, and I can look at it and find out whether there are irregularities in the back of the eye or if it's just nice and smooth, so that you would do well with any type of lens. The next visit is going to be a long discussion with my patients about their lifestyle, their hobbies, what exactly do they want to get once they have cataract surgery. And for that, I need to know a little bit about my patient and ask the right questions. And of course, have the information from the lens star, from the OCT to make sure that I match you up with the correct lens. Hi, Ruth. Hi, Peg. Hi, Shima. And basically, that's going to be a discussion between you and I to decide whether or not a standard lens, which is what has been available for the longest time, if that is what will work for you, versus the specialty lenses. And of course, the specialty lenses are the ones that have an additional out-of-pocket cost. And so we definitely want to work closely together in order to match you up with the correct one. So your option with the standard lens is that it will correct your vision at one distance. It's monofocal, single focus. So it essentially will correct your vision, let's say at distance, only if you do not have any astigmatism. So that means that if you have astigmatism left over after cataract surgery, you would need to wear glasses still in order to have the finest vision possible. And of course, you would have to wear glasses in order to have mid-range, like me looking at this camera, and close-up reading vision. So essentially, you're committing to progressive lenses, or lenses to be able to do both. Specialty lenses, there's a wide variety. So depending on whether or not you've had refractive procedures like LASIK or KPRK in the past, or if you have any little bit of defect or not in the macula, then you have the option of having lenses that are possibly progressive, meaning they act almost like a pair of progressive glasses, but they're inside the same bag that used to hold your cataract, and they can potentially allow you to be eyeglass free most of the time. I never guarantee 100% of the time because everybody's different, but you could have a range of vision far away to mid-range to close up. And those lenses, of course, are an out-of-pocket cost, and sometimes they're not necessarily for everyone. So that's definitely a conversation that we would have together. These are some of the most common questions that I've gotten that I've tried to answer for you. I hope that if you're watching this as a replay, you'll do hashtag replay in the comments and let me know if there's some other questions that you would like me to address in my next video, whether it's live or not. We'll see how it goes, and let me know if this has been helpful for you. I appreciate everybody that's hopped on to listen to these comments and answers for me. And also, if you are looking for an ophthalmologist in Grass Valley and Roseville, and you want someone to work in order to provide you the best vision possible to enjoy your hobbies and activities for your upcoming weeks and years, for the rest of your life, you can contact me. You can go on my website, which is mitramd.com, and you can get all the information. You can even request an appointment on my website, and we'll get back to you as soon as possible. So Peg is asking, is there anything that can be done to prevent cataracts? So ultimately, Peg, if we live long enough, all of us are going to develop cataracts. Now, we can do certain things. I kind of touched on it a little bit before, and I have in the past, but the most important thing is to make sure that you protect your eyes against UV rays, which, sunglasses, right? And then, of course, making sure that if you have any medical conditions like diabetes or hypertension, you are going to your primary care and controlling, blood sugars, because diabetes can kind of cause a rapid progression in your cataracts if the blood sugar is not controlled. And of course, there are certain situations where you're taking medications like prednisone for rheumatoid arthritis or other things that's sort of out of your hands, but you want to follow up with your eye care provider to make sure that you are doing everything you can to monitor your vision, monitor your eyes, and make sure that if something develops or you have a need for cataract surgery, that you get to it right away. um, Kelly, thank you for that comment. I'm happy to see you at any time. But all of you, I know you're at least on my Facebook page. I do have an Instagram page also, and that's MitraMD3. That's where you'll know about upcoming videos and any information that I may post as far as your eyes are concerned. So I would appreciate it if you like the Facebook page and also get on the Instagram page, and I will see you next time. Thank you for showing up. Take care.